Now I want to talk about the Harrow and Jobe longitudinal study, which was funded by the NIMH. So Martin Harrow is deceased now, but was a psychologist at the University of Illinois College of Medicine. And what they did in the study was recruit patients from two different Chicago hospitals, one public and one private. They divided the patients into two different groups, one group with schizophrenia and the other group with a mood disorder, depression or bipolar with psychotic features, or a milder psychotic disorder. And then they periodically followed up with them over the years and assessed how they were doing. So were they recovered? Were they symptomatic? Were they on medications? Were they in treatment? How were they doing socially? Were they working? Things like this. So they followed up at 2 years, 4.5 years, 7.5 years, 10 years, 15 years, and then 20 years. So here is a quote from a 2012 article, which is when they published their 20-year results, and this explains the study. A total of 139 early young psychotic patients from the Chicago follow-up study, including 70 patients with schizophrenia syndromes and 69 with mood disorders, were assessed prospectively at the acute phase and then followed up 6 times over the next 20 years. Patients were assessed with standardized instruments for major symptoms, psychosocial functioning, personality, attitudinal variables, neurocognition, and treatment. So if we were looking to validate Jung's theory on psychosis and schizophrenia, what would we expect to see? We would expect to see a group of the patients that were recovered, that were not symptomatic, that were adapted socially, that were not on medications, that were not in treatment, and that had a return of a strong, stable sense of self, a return of ego strength. This would be evidence that even though they were diagnosed with schizophrenia, they didn't have a brain disease or a broken, dysfunctional brain. Because if they did, they would have to be maintained on medication in order to be able to function. So if there is a group of the patients that are functioning well, are not symptomatic, this is evidence that they moved through their psychosis, they transcended their symptoms, and that the process of psychosis came to a completion. So this is a description of what they found, also published in their 2012 article. At each follow-up, 30 to 40% of schizophrenia patients were no longer on antipsychotics. Starting at the 4.5-year follow-ups and continuing thereafter, schizophrenia patients not on antipsychotics for prolonged periods were significantly less likely to be psychotic and experienced more periods of recovery. They also had more favorable risk and protective factors. Schizophrenia patients off antipsychotics for prolonged periods did not relapse more frequently. So another thing I want to point out is that these patients had these favorable outcomes also had favorable risk and protective factors. So this is also aligned with Jung's thoughts that not everyone is able to bring this process of psychosis to a completion, and a lot of it has to do with your initial strength of your sense of self and also social support and things like that. So this is a table showing the global adjustment of the two different groups of patients over 15 years of follow-up. So on the left, we have the schizophrenia patients, and on the right, the other psychotic patients. I'm just going to stick with the schizophrenia patients, even though the results of both groups are similar. So they used the global functioning and adjustment scale, which goes from 1 to 8. The higher the number, the worse off the patients are. So the closer the number is to 8, the worse their functioning is. So what we see is that at every year of follow-up, the patients not on any medications are doing significantly better than the patients on antipsychotics. And in particular, at the 4.5-year mark, there is significant improvement. So from the 2-year mark to the 4.5-year mark, there's something going on in these patients that is contributing to the improvement that we're seeing here. And if we're using a Jungian lens to interpret this, if we're going to use his model, we would say, well, in order to move through schizophrenia or psychosis, to bring the process to completion, there must be successful development, adaptation, growth of the personality, because the process was initiated to bring this development on. So perhaps during this period is when this is occurring for most of these people. This is when the upgrading of their character, the growth, the psychological growth is setting in, the concretization of the completion of their psychotic process, an upgraded, stable sense of self and view of the world. So what we see is that it takes time for this to occur. So if you give people time to move through this process, there are going to be some people who do this successfully and who recover. Now, on the flip side, we could say that the individuals maintained on antipsychotics, that the antipsychotics were blocking them from completing this process. They were separating them from their emotions and from their symptoms, so they were blocked from moving through the psychic processes that would have been necessary to achieve the adaptation of their personality. So the antipsychotics caused an abortion of the process, caused the individuals to stagnate, and their symptoms would have kept coming back because they never achieved the growth of the personality that the psychosis was trying to achieve. Now, to be fair, we could also say perhaps that maybe the individuals on the medications had a worse prognosis and were worse off from the beginning, and Martin Harrow thought that they had that they had a weaker sense of self, reduced ego strength. So this would have perhaps prevented them from successfully dealing with and handling and integrating their symptoms and experience. This is also plausible. Just to give you some more data on this as well. So at the 15-year follow-up, 40% of those off drugs were in recovery, and more than half were working, and only 28% suffered from psychotic symptoms. In contrast, of those taking medications, only 5% were in recovery, and 64% were actively psychotic. So this is a graphic depicting the data from the table we just looked at in the previous slide on the global functioning assessment of the different groups of patients on and off medications. So the groups labeled manic depressive on and off meds. In this graphic, these are the same people that were labeled other psychotic patients in the previous table. So where I want to start at is at the 2-year point, where we can see the manic depressive group on medications and the schizophrenia group off medications are essentially doing the same. They're functioning at the same level. And then there's this 2.5-year period in between follow-ups where there's a significant degree of separation between them, and there's a significant degree of improvement in the schizophrenia group off meds. And we also see this in the manic depressive group that are off meds. And then if we look at the two groups that are maintained on medications, from the 2-year point on, there is no improvement. There's a bottoming out, a stagnation of their functioning. But if we just want to compare the manic depressive group on meds and the schizophrenia group off meds, this is very interesting, because if we are looking at this through the lens of conventional psychiatry and conventional psychiatric wisdom and understanding of mental diagnoses, these results don't make sense. It doesn't make sense that there is this large of a difference between the functioning in these two groups. So obviously, psychiatry looks at mental health diagnoses through the lens of biological imbalances, physiological abnormalities, some sort of dysregulation in the brain or neurochemical imbalance that's occurring. That's the root of the mental health issue. So we would expect through traditional psychiatry that the group labeled manic depressive on medications that are receiving treatment addressing the so-called abnormalities going on in their biology would be doing better than the group of schizophrenia patients not receiving any sort of standard treatment to address the so-called imbalances in their brain, especially when you consider schizophrenia is also considered a neurodegenerative brain disease that gets worse over time. And as a whole, a group of people diagnosed with schizophrenia should be functioning worse because schizophrenia is considered one of the most severe diagnoses you can receive when it comes to functional impairment. So you wouldn't expect a group of people diagnosed with schizophrenia to be functioning better off medications than a group diagnosed with a mood disorder or a milder psychotic disorder receiving treatment, at least not using standard psychiatric understanding. We can make sense of these results, though, if we use Jung's model and views on the psyche, the role of symptoms and mental illness, and what the purpose of these things are. Because the psyche has a telos, an aim, a direction, a goal of growth and development and evolution of the personality, symptoms have meaning, and mental health issues manifest when the psyche is attempting to spur some sort of psychological growth to occur in the personality. And so we would assume that both of these groups off medications improved because they actualized the psychological growth that their psyches were requiring for the development of the personality. And because of this, their symptoms improved, their adaptation to the world, their functionality improved, or in other words, progression took hold again. Whereas the groups on medication, for whatever reasons, their ability to achieve the psychological development that their psyches were asking of them was impeded. It was blocked. It never occurred. And there could be many reasons for this. Potentially these people as a whole had less ability to cope and deal with stress. They had less internal resources, inner resiliency, weaker ego strength, a weaker sense of self. They could have had more traumatic upbringings that impeded their ability to develop a strong ego or sense of self. Potentially, they also had less supportive social relationships. There could be a bunch of reasons, as well as the medications themselves could have acted as some sort of impediment to their development, especially when we focused on antipsychotics, because we know they shrink the frontal lobes, cause cognitive impairment, separate or detach people from their emotion. So in the attempt to suppress the symptoms, there are side effects. And in Jung's model, if you are simply suppressing the symptoms, you are going to be stuck in what he called neurotic suffering. So if we remember the difference between natural and neurotic suffering, an intrinsic part of life that the psyche uses to catalyze growth of some sort or adaptation, and neurotic suffering is a result of what happens whenever natural suffering is avoided or necessary developmental steps to the psychological maturity and adaptation of the individual are impaired, impeded, not confronted or avoided. So it could be the difference in what we see between these two groups if we are interpreting things through a Jungian model. Okay, so one more graph from the study. What you're looking at is a comparison of the outcomes for the two different schizophrenia groups. So the group that went off antipsychotics and the group that stayed on antipsychotics. So starting from the left, we see that 44% of the group that went off their medication achieved recovery. So they achieved remission of their symptoms and had good social functioning, whereas only 5% of the group that stayed on antipsychotics achieved this recovery. And then we see 40% of the off antipsychotic group had a fair or okay outcome, whereas 46% of the on antipsychotic group had a fair or okay outcome. And then only 16% of the schizophrenia group that went off antipsychotics had a poor outcome, whereas 49%, basically half of the group that stayed on antipsychotics, had a poor outcome. So consider what I've shared about Jung's approach and his model of psychosis and schizophrenia and come to your own conclusion about these results. But what should be clear is that there is a subset of people who experience psychosis, who are diagnosed with schizophrenia, who move through these symptoms and achieve recovery, who achieve pre-morbid functioning, who do not need lifelong medication management, and it is a disservice to treat them as if they have a brain disease. They would be much better served by approaching their treatment from a Jungian view that what they're experiencing is a process, and if this process can be brought to completion, then they can recover and return to functioning at a high level. And the reason that clinicians don't have this view and don't see these patients recover is because the patients that do recover leave. They leave the system, and so you aren't going to see them.